Acute osteomyelitis in children. Staphylococcus aureus is responsible for 17 to 90% of acute osteomyelitis in children. Usually, the site of infection is locally in a tubular bone, and blood vessels are metastatial, which commonly suffer the initial impact. Clinical manifestation. Most patients develop bone pain for 1 or more days, steady and gradual onset. The pain is usually fluctuating depending on the posture and movement. On older children, it is local, which is not often seen in infants or when present with pelvic. Osteomyelitis are locally in long bones and only in 25% of cases affect or tubular bones or not.
It's a condition that can strike an otherwise healthy child, but knowing the symptoms of osteomyelitis can make the treatment much more manageable. We find out more in today's Health Matters. Bacteria. It not only lurks on doorknobs, keyboards, and playgrounds, it lurks in our bodies, whether we like it or not.
Everyone has a little bit of bacteria traveling around their system, and that can be caused by something as benign as brushing your teeth.
Sometimes the bacteria can travel into the bloodstream and affect the bones, a condition called osteomyelitis. Children are the most vulnerable. Pediatric orthopedic surgeon Dr. Matthew Wagner demonstrates how a child's knee can be affected.
They have leaky blood vessels. The endothelium are the cells that cover blood vessels, and they're not as tight, making this transient bacteria that's in all of our systems a little bit more likely to exit in these areas. The knee, in a skeletally immature patient, is affected in over 50% of spontaneous, acute, hematogenously spread osteomyelitis.
As Dr. Wagner explains, the bacteria can spread dramatically.
Once it has established itself within the bone itself actually has a network of what's called conversion canals that allows cells within the bone to communicate with each other. The bacteria can then use that to communicate.
That's when children start to show symptoms.
Which probably one of the most common is pain in an extremity, limp, especially in young children where they can't tell you, Mommy, it hurts here. You'll see them favoring one leg. Certainly there can be swelling, there can be redness over the area, and fever. These are some of the more common symptoms.
These symptoms should not be ignored. Osteomyelitis can be treated with antibiotics. For those with more severe cases, surgery may be in order. Reporting for Lee Memorial Health System, I'm John Bafar. Infants can also be affected.
Diagnosis. The initial diagnosis causes clinical suspension. The erythrocytes sedimentación dry cultures of bone. During fluid and blood tests are helpful. The imaging study included radiography, scintigraphy, and in some cases ultrasound, CT, and MRI.
How it's treated. Osteomyelitis is a type of bone infection caused by bacteria that can affect almost anyone. Children who become infected usually have their long bones affected, particularly the bone. Adults typically see infection in their vertebrae and hips. Since almost anyone can become infected, it is important to understand what some of the risk factors are. Contributing risk factors for osteomyelitis include circulatory problems, including diabetes, artery disease, sickle cell disease. Recent injury, like bone fractures and punctured wounds. Use of street drugs, non-sterile needles creating puncture wounds near the bone. Osteomyelitis can cause quite a few secondary complications. In children, osteomyelitis can damage the growth plates, which can lead to impairment in growth. Occasionally, the infection can move to the other joints, causing septic arthritis. In the worst cases, the infection can cause the bone to die due to a decrease in blood supply to the bone. Treating osteomyelitis can be a long process. Orthopedic physicians may suggest starting with a bone biopsy to help choose the best antibiotic to treat the particular infection. Antibiotic treatments usually last around 6 weeks and are administered through an IV. Many cases of osteomyelitis require surgery. Surgery may be done for a variety of reasons, including draining the infection, removing infected bone, getting blood back into the bone, or, in the worst case, amputation. If you are
Treatment: antimicrobial therapy should be instituted in all cases. The affected bone and spirit for culture should be antigen unless the blood culture is positive. Incision as drainage should be actually made when there is superiostical access. Antibiotics proven eficaz against Staphylococcus aureus, including antiphyllococcus, penicillin, clindamycin, pure regeneration, cephalosporin, and vancomycin. Conclusión: depend on the early diagnostic and treatment. Mortality is low and complications rate approximately 5%. Because of the various causes of the disease, recommended that treatment is individualized for each case. Antimicrobial therapy should be used in all cases. The effect on spirit for culture should be active only the blood culture is positive.